Here are 5 of the most common treatments for bacterial vaginosis. The first is metronidazole, also known as Flagyl. This is an antibiotic that's given orally through pills or intravaginally through a gel. The guidelines from the CDC recommend 500 milligram pills taken twice a day for 7 days, or a full applicator of 0.75% gel applied inside the vagina once daily for 5 days. The next is clindamycin, which is another antibiotic. This is given orally through pills or intravaginally, either through tablets inserted or cream applied internally. Typically, vaginal and oral clindamycin should be taken for 7 days, but sometimes a provider will recommend using clindamycin ovules, which are basically these little pills that you place inside the vagina and allow to dissolve, and that usually just takes 3 days. Then third treatment is tinidazole, which is both an antibiotic and an antiprotozoal. Tinidazole is typically administered orally through pills. The fourth is an antibiotic called secnidazole, and this is administered orally via granules taken by mouth. So essentially what that means is that you sprinkle the medication onto a soft food like yogurt, and usually only 1 dose of these granules is required to treat bacterial vaginosis. And then finally, the only non-prescription treatment for bacterial vaginosis that I'm going over in this video is boric acid. What you should know is that boric acid prescribed by a doctor tends to be more pure and less likely to cause adverse reactions than boric acid purchased over the counter or online. So if you're going to use it, always try to get it prescribed by a healthcare provider.